Us about potassium sparing diuretics, which is the last class of the diuretics. Potassium sparing, as the name suggests, that these diuretics increase the concentration of potassium in our body, right? And hence the name is the potassium sparing diuretics. So regarding the mechanism of action, the two drugs in this class of diuretics are the trimiptylene and the amiloride. Okay, so these two are the agents of the potassium sparing diuretics. The agents are trimiptylene and the amiloride. Individually, amiloride and trimiptylene exert a mild diuretic effect and are usually used in combination with the thiazides or the loop diuretics. So these potassium sparing diuretics like trimiptylene and the amiloride, they are generally given in combination with the thiazides or the loop diuretics. Loop diuretics, what is another name of the loop diuretics? That is the high ceiling diuretics, high ceiling or the loop diuretics. In vitro experiments have shown that they exert a diuretic effect by blocking an epithelial sodium channel in principal cells of the late distal convoluted tubule and the collecting duct. Okay, so in vivo studies, it was shows that these trimiptylene and amiloride, when they are given in combination with the thiazides or the loop diuretics, so they block the epithelial sodium channel. Epithelial sodium channel, over where the location is the late distal convoluted tubule and the collecting duct. So they increase the they decrease the concentration of the sodium ion. Once they decrease the concentration of sodium ion, then the potassium concentration is get simultaneously increased. Sodium decrease, then the potassium will increase. So this is how these potassium sparing diuretics work. Now both the drugs, that is the trimiptylene and the amiloride, they are the weak organic bases and inhibit epithelial sodium channel in a voltage and pH dependent manner. Inhibition occurs because amiloride and trimiptylene, they bind to negatively charged regions of the sodium channel in the epithelial sodium channel. The greater potency of amiloride is probably due to the fact that it is a stronger base and is therefore more extensively protonated at physiologic pH than the trimiptylene. So if we compare both the drugs, that is the amiloride and the trimiptylene, that amiloride is a stronger base having pKa 8.7 if we compare the pK of trimiptylene, which is 6.2. So the amiloride is a stronger base. If it is a stronger base, then it is protonated at the physiological, easily protonated at the physiological pH. The sodium channel inhibitors, they block the reabsorption of the sodium ion and inhibit the secretion of the potassium ion. The net result is increased sodium and the chloride ion and excretion in the urine and almost no potassium excretion. As a consequence, amiloride and trimiptylene used to offset the effect of the diuretics that result in loss of the potassium. Okay, and so these amiloride and trimiptylene, when they are given alone, then what will happen? They also excrete the potassium ion, and hence these potassium sparing diuretics, they generally given with the combination with the thiazides or the loop diuretics. So these thiazides and loop diuretics, when given in combination with the trimiptylene and amiloride, then they inhibit the sodium channel, they inhibit the epithelial sodium channels, and they inhibit the entry of the sodium ions into the cell, and thereby they increase the concentration of potassium ion in the cell. Once they inhibit the sodium, then simultaneously potassium ion concentration is get increased. So the first drug, that is the trimiptylene. Trimiptylene belonging to the class of the pteridines. Okay, trimiptylene belonging to the class of the pteridine. So this is the pteridine ring. If you check, this is the pteridine ring. Okay, now this pteridine ring is there in our drug, that is a trimiptylene drug. Okay, now The ring is same, only there are substituents amino, 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 and the phenyl substituent is there. So this is the numbering of your pteridine. So what will be the IPC nomenclature? So first we will nomenclate 6 phenyl, 6 phenyl, 1, 2, 3, 4, 5, 6, 6 phenyl, pteridine 2, 4, 7 triamine, or else you can also nominate it as a, if we consider if we nominate this structure by alphabetical order, then it may be 247 triamine 6 phenyl pteridine. So I think the second one is correct, that is a 247 triamine 6 phenyl pteridine. So I think this IPC nomenclature is correct because we follow the alphabetical order. Okay, so the further structural modification of the pteridine nucleus, the further structural modification of pteridine nucleus led to the development of the triamterene. Alteration of the triamterene structure are not beneficial in terms of diuretic activity. Activity is retained if an amine group is replaced with lower alkyl amine group. Introduction of a paramethyl group. So introduction of a paramethyl group. So over here this is a para position because this phenyl ring is attached to this pteridine ring at this position. So the para position is this one. So if you introduce paramethyl group on the phenyl ring, it decreases the activity by approximately half. So this is what about the structural modification of the triamterene. So the amino group is mandatory. If we replace this amino group with some other lower alkyl amine group, then also it retains the activity. And if we introduce a methyl group on the para position of the phenyl, then it decreases the activity. So this is the structural modification. Regarding the therapeutic application, triamterene is more than 70% absorbed on oral administration. The diuretic effect occurs rapidly, that is approximately 30 minutes, and reaches peak plasma concentration in 2 to 4 hours with a duration of action more than 24 hours. Okay, so within 30 minutes it shows the diuretic activity, and it reaches its peak plasma concentration in 2 to 4 hours, and the duration of action of this diuretics is around for 24 hours. This triamterene, they are extensively metabolized into the 4-hydroxy triamterene. So over here the metabolite is mentioned. So this is a 4-hydroxy triamterene. The hydroxy group is attached at the phenyl ring, para position of the phenyl ring. So the resulting metabolic product is 4-hydroxy triamterene and to its sulfate conjugate now both of the metabolites are active. If we compare these metabolites with the triamterene, then they show the activity similar to the triamterene. Okay, both the drug and its metabolites, they are excreted in the urine. This triamterene is useful in combination with thiazide or the loop diuretic in the treatment of the edema or hypertension. Okay, so this is what about the drug triamterene. Then the next one is the amiloride, as this contain the amino pyrazine ring. So this one is the amino pyrazine ring. So this drug amiloride, it come under the subclass of the amino pyrazines. Regarding the IPC nomenclature, again 3,5-diamino 1, 2, 3, 4, 5, 6. Okay, so it is 3,5-diamino 6-chloro and dash diaminomethylene. Now again check it out over here. It is diamino, then one carbon. So we cannot nominate it as a diaminomethyl. No, it is wrong because there is a double bond over here. Hence it is diaminomethylene. And the remaining portion, that is a pyrazine 2-carboxamide. the carboxamide ring or the carboxamide group is attached at the second position. Hence it is pyrazine 2-carboxamide. Okay, so this is all about the amiloride. Now amiloride is an aminopyrazine structurally related to trimethylene as an open chain analog. It has no effect on the action of the aldosterone. Oral amiloride is approximately 50% absorbed with the duration of action for around 10 to 12 hours, which is slightly longer than that of trimethylene. Although trimethylene is metabolized, approximately 50% of amiloride is excreted unchanged. Renal impairment can increase its elimination half-life. Like trimethylene, amiloride is combined with the thiazide or the loop diuretic to treat edema or the hypertension. The aerosolized means if amiloride is prepared in the form of the aerosol, then has shown some benefit in improving mucociliary clearance in patients with the cystic fibrosis. The most important side effect associated with the amiloride is the hyperkalemia, as these are the potent sparing diuretics, but by the excess use of this drug it causes the hyperkalemia. Okay, so this is what about the your drug, that is a amiloride. Then again we have summarized these things, that is the site for diuretics or the potassium sparing diuretics. These drugs increase sodium and chloride excretion without a concomitant increase in the urinary excretion rate of the potassium. These agents are known as potassium sparing diuretics or antidiuretic agents. These site for diuretics or the potassium sparing diuretics, they are classified into the two subclasses. One is the aldosterone antagonist, example is spironolactone and the eplerenone, and the second one is the direct acting diuretics, example is trimethylene and the amiloride. Regarding the properties and uses, these agents are not potent diuretics when used alone, but when combined with a thiazide. So whatever these potassium sparing diuretics, they are given with a thiazide or the loop diuretics to show its action. They reduce potassium loss and increase sodium excretion. Yes, so whatever the excretion of potassium is occur because of the use of the diuretics. The work of the diuretics is what? To excrete the electrolytes. So these potassium sparing diuretics, they reduce the loss of the potassium, but they increase the excretion of the sodium. They minimize the alkalosis. The onset of diuretics with combination therapy is much more rapid than with the spironolactone alone. Again, this is the structure of the spironolactone which I discussed. Check out properly the structure of the the spironolactone. Again, this ring is the pregnant ring or preg 4-in ring because there is a double bond in between carbon 4 and 5, and this is its IUPAC nomenclature, or we can nominate this structure by this IUPAC nomenclature. There is 7 alpha acetyl thio 3 oxo 17 alpha preg 4-in 21-17 beta 21-17 beta carbolactone. I have told you why there is a 21-17 because this carbonyl group and this oxy group, they are They are in lacto drink in between carbon number 21 and 17, and hence it is 21 17 beta carbolactone. So the uses are, they are used in the treatment of edema. They are antihypertensive agent. The use is in combination with the diuretics that act at site 2 or 3 to reduce the hypokalemic effect of the latter group of the diuretics. The adverse effect is hyperkalemia because they reduce the excretion of the potassium. So what happened? Hyperkalemia is observed by the use of this spironolactone or the aldosterone antagonist. Then they also cause the metabolic acidosis. Then they cause gynecomastia in men and breast tenderness and menstrual disturbances in women because of its residual hormonal activity, and also it causes some minor GIT symptoms. So this is the metabolism of the spironolactone. So this spironolactone is metabolized into the candrenone by the hydrogenation reaction. By the hydrogenation reaction, uh, uh, wait for a second. Okay, so over here this candrenone metabolite is formed by the removal of this acetyl thio group, right? By the removal of this acetyl thio group results in the formation of the candrenone. So here is the deacetylation reaction is observed to form the candrenone. Then we have we saw the drug triamterene. So this is the structure of the triamterene. Then regarding the SAR, the para substitution on the phenyl ring with the hydroxy group, it increases the activity. The phenyl group can be replaced with smaller heterocyclic ring. The amino group must be unsubstituted. It has a structural similarity to folic acid and certain dihydrofolate reductase inhibitors, but it has little, if any, of their activities. So this is what about the SR point of the triamterene. Regarding the adverse effect, it causes hyperkalemia, renal stones formation, and cause GIT symptoms. Uses, they are used in the treatment of the edema and the hypertension, and also they used in combination with the other diuretics that act at site 2 or 3 to prevent the hypokalemia. Then we saw this drug, that is the amiloride. Just we saw this drug amiloride. So over 25,000 agents were examined in an attempt to discover an anticholinergic with no hormonal activity. Optimal diuretic activity is observed when the sixth position is substituted with the chlorine. Then second, the amino group at position 3 and 5 are unsubstituted. Then the guanidino nitrogen. So this one is a guanidine, right? This one is what? Guanidine. In IUPAC nomenclature, what we nominated this? Diamino, then methylene, right? So we are nominated like this. So the amino group at 3 and 5 positions are unsubstituted. The guanidino nitrogens are not substituted with the alkyl group. Okay, so this is what about the SR points of the amiloride. Regarding the mechanism of action, as we know, these are the potassium sparing diuretics, so they reduce the excretion of the potassium ion and they increase the excretion of the sodium ion. Then yes, the last class is remain. Now this one is the last class, that is the osmotic diuretics. Osmotic diuretics. Now these osmotic diuretics, they are the low molecular weight compounds. They are freely filtered through the Bowman's capsule into the renal tubules. They are non-reabsorbable solutes and are not extensively metabolized except for glycerin and the urea. Once in the renal tubule, osmotic diuretics have a limited reabsorption because of their high water solubility. When administered as a hypertonic solution, these agents increase intraluminal osmotic pressure, causing water to pass from the body into the tubule. Since the osmotic agents and associated water are not reabsorbed from the nephron, a diuretic effect is observed. So these osmotic diuretics, they increase the volume of the urine and excretion of water and almost all of the electrolytes. So these osmotic, how these osmotic diuretics works? How these osmotic diuretics works? These osmotic diuretics, uh, by producing osmosis, they excrete all the electrolytes and the water from the body or from the nephron. Right? This is how the osmotic diuretics works. Okay. As these are the low molecular weight compound, osmotic diuretics, they are what? The low molecular weight compound, and they are easily solubilized into the water. So they, by producing osmosis, they excrete all the electrolytes and water from the body, and thereby the diuretic effect is observed. The drugs are mannitol and the isosorbide dinitrate. So we have seen this drug isosorbide in our anti-anginal agents. Mannitol is there. Mannitol is what? It is a sugar molecule. Mannitol. Mannitol is the agent most commonly used as an osmotic diuretic. Sorbitol also can be used for similar reasons. Now this compound prepared by electrolytic reduction of the glucose or the sucrose. Okay, so this mannitol, it is synthesized by the reduction of the glucose or the sucrose. Mannitol is administered by the IV route in solutions of 5 to 50% at a rate of administration that is adjusted to maintain the urinary output at 30 to 50 milliliter per hour. Okay, so they increase the urinary output by around 30 to 50 ml per hour. Mannitol is filtered at the glomerulus and is poorly reabsorbed by the kidney tubule. The osmotic effect of mannitol in the tubule inhibit the reabsorption of water, and the rate of urine flow can be maintained. It is also used to reduce intracranial pressure by reducing cerebral intravascular volume. So this is what about the mannitol. So mannitol is what? Mannitol is a osmotic diuretic. This mannitol is synthesized by the reduction of the glucose or the sucrose, and these are given by the intravenous route. And by once we administer the mannitol by the intravenous route, then they maintain the urinary output around 30 to 50 ml per hour. So how they work? This mannitol, once they produce osmosis, they excrete the electrolytes from our body. So that is what about the osmotic diuretics. And this is its IPC nomenclature. So 2R, 3R, 4R, 5R. So it is not mandatory to give the RNase configuration. So you can write down as hexane, because there are 6 carbon in a straight chain. Hexane 1, 2, 3, 4, 5, 6 hexol. So this is the IPC nomenclature of the mannitol. Hexane 1, 2, 3, 4, 5, 6 hexol, because there is a OH group on each carbon. OH group, that is alcoholic group on each carbon, hence it is hexane 1, 2, 3, 4, 5, 6 hexol. And this one is the isosorbide. Isosorbide is basically a bicyclic form of sorbitol. Okay, it is a bicyclic form of the sorbitol that is used orally to cause reduction in intraocular pressure in glaucoma cases. So this isosorbide is used in the glaucoma cases to reduce the intraocular pressure. Although a diuretic effect is noted, its ophthalmologic properties are its primary value. As we have discussed this drug in the anti-anginal agent, and this is its IPC nomenclature, that is 1,4,2,3,6 dianhydro D-glucitol. Okay, this is the isosorbide. Osmotic diuretics, they have the following key feature. They are passively filtered by the glomerular filtration. They undergo limited reabsorption in the renal tubules. They are metabolically and pharmacologically inert, and they have a high degree of the water solubility. Examples are mannitol and the isosorbide.